Some people in Windsor with disabilities say they're in the dark about when it will be their turn to get a COVID-19 shot. They still don't know if they qualify to be prioritized based on their conditions. As CBC's Mrinali Anchan reports, it's a different story across the border.
For people with disabilities, they're in a higher risk group. So certainly we would hope that it would be faster than it's been.
Anchan has spastic quadriplegic cerebral palsy. Some studies show it gives him a greater risk of complications from COVID-19. The waiting means further isolation.
I was about to start a job, and then before COVID hit, and then COVID started, and my contract got suspended. So I think a lot of people with disabilities are dealing with the social isolation.
As for the potential timeline when he and others with disabilities may get the vaccine, the Windsor Essex Health Unit says it's waiting for direction from the province. Across the border in Detroit, the rollout looks different.
Organizers with disabilities like myself are extremely proud to have had this major win.
Her organization has pushed to get Detroit to broaden vaccine eligibility. As of February 11th, people with intellectual and developmental disabilities got access to the shots.
Disabled people around the country, and apparently in Canada too, are noticing that this should be a priority. It can be done.
On this side of the border, some in the disabilities community still have a lot of unanswered questions.
I'm not at all sure that my disabilities would qualify me or should qualify me, but I'm not speaking primarily for myself. I'm speaking from the perspective of someone who values all lives.
As a dual citizen with ADHD, she qualifies to get vaccinated in Detroit. But with the border closed, that's not happening.
We don't have the data because we haven't collected it. Then we don't have that science, right, to inform our decision making.
While there are efforts by the province to track trends, there is still no data on how many people in the general public with disabilities have contracted COVID-19 and died. In a statement to CBC News, the Ministry of Children, Community and Social Services noted there have been 699 cases and 23 deaths of adults with developmental disabilities in ministry-funded group homes. Globally, a study from the UK found that from January of 2020 to November 2020, 6 of 10 COVID deaths were people with disabilities. Although no date in sight, Anchan is hopeful that vaccination is on the horizon for people with disabilities.
And I think the pandemic has really afforded us the opportunity to reassess our values and priorities when it comes to advocating for people with disabilities.
Mrinali Anchan, CBC News.